Six.
Okay,
Yeah.
okay. Yes. Hello, everyone. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, Said GSMC Medical College and KM Hospital, welcomes you to this session of reminiscences. Now, I would like our tech team to play the video about the Division of Medical Humanities.
It is the students' past and present that makes our college what it is. So, as our Twin Institute moves towards the centenary, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of the college. Their thoughts and emotions will be preserved forever in the form of these reminiscences. I would like to request the tech team to show the GA membership form. To remain connected to our alma mater and informed about the activities in the KEM, including its centenary celebration, we request you to become the members of Gosumec Alumni Association, the official alumni body at State GSMC. All the details and this membership form are available on the KEM website.
Now, I would like the tech team to show the Gosumec Foundation slides. Gosumec Foundation was established in California, United States, to give back our alma mater, which has helped so many professionally and personally. The website allows you to enjoy the nostalgic content, including the history of our institution, medical humanities, archives, and many more. Now this is the slide 1. The slide 1 shows the web address https://gosumec.organization. At the footer of the website are the links to the social media accounts, including YouTube, where you can access all the virtual reunions. Now for the slide 2. This slide shows the mission of Gosumec Foundation, which is connect, contribute with the 3 T's and engage. Connect the global matter, contribute to the alma mater's development by sharing the 3 T's: time, talent, and treasure. Engage Gosumecs with nostalgic media on the continued basis and enable global networking. Now on the slide 3, it shows how to access the Google form, which many of you may have filled already by the link which was circulated by a group lead. The data from the Google form. The objective of this form is to connect with each other and alma mater. Gosumec Alumni Association GAA, which is the official alumni body at say GSMC and KEMH. This information will be secured between the GAA and the Gosumec Foundation and will be later used to create a secure searchable database. Looking forward to the Gosumec supporting our mission to connect, contribute, and engage. Now, I would like the coordinator from the batch to take over the proceedings.
Thank you. First of all, I am very thankful to the Alumni Association for having our batch speak today. Hello to Dr. Natarajan and hello to Sejal and so the student coordinators. I am Amol Pawar, and on behalf of the GSMC 94 batch, I would like to initiate the proceedings. And I call upon Dr. Amit Mandot to begin with his talk. Amit Mandot, are you there? Amit Mandot?
Yeah,
Amol, we
hi.
can go to-
Hi.
Yeah.
Hi, Amol.
Start, yeah.
Yeah. Good evening, friends. And this is actually a great pleasure to connect with all our GSites. So I'm Dr. Amit Mandot. I am the alumnus of 1994 batch. We call ourselves the millennial batch because we completed in 2000, the batch of 2000. I'm currently practicing as a gastroenterologist and hepatologist in Mumbai. I'm the head of Department of Hepatology at Global Hospital. So it's been a great journey. Did my MD medicine from Sion Hospital, did my super specialization in gastroenterology, and did my fellowship in liver from Paris. And since then, I've been practicing in Mumbai. But I think at core, at my heart, I'm a true GSite in the sense my foundation was built in GS Medical, and I still feel that foundation has served me very well. The fondest memories which I have of GS Medical during my student days have been very actively involved in student activities. So I was the Wallpaper magazine secretary in 1996 and the general secretary of the Gymkhana 1997. So the student activities helped me connect with other friends, connect me, be a part of organization, and those organizational capabilities has helped me tremendously. One of the fondest memory was being actively involved in Avishkar, which is a cultural program, and seeing the successful cultural program in 1996 was one of the pinnacles of my student days. Other very important thing which I still remember from KEM days was a program of preceptorship. That was something which is unique. I have not heard it from any other medical college, and that's something which I feel, because as a junior, when you enter in, you have been allotted 3 seniors who will look after you, whom you can go to in times of problems, is something of a great concept. Recently, I was called to give a talk at Terna Medical College, and there they had this kind of a program again for students, which reminded me of those days. But that was something very unique, and I think we should continue with that concept. How has college changed in those days and now? I think I've not been to college off late, but I still remember the canteen remains the same. I'd been there 2 years back, and the food remains the same. The Anna's food is still the same. I know there's a new hostel which has come up, which was always the need of the hour. So that's something great. But I think the core, the heart of GS is still around the katta, the library, the college building, and that probably remains the same what it was in 1994 and now. So pleasure to connect with all of you, and have a great evening and have a great life ahead, all GSites. Thank you.
Thank you, Amit. Swapna, you next.
Thank you, Amol. Amit, that was great. First of all, I would like to thank Dr. Natarajan, the student coordinators, the tech coordinators, everybody who has helped with this huge endeavor. I think it's a wonderful thing. And it's a delight to be here today to reminisce the wonderful times that we all like to call GS. It would be fair to say, I think, that all of us here at GS, it has been an unforgettable, inseparable experience of our lives. I often like to say it was the best time of my life. I've learned so much of life and medicine in these 5.5 years that I cannot imagine it being any other way. It was the foundation. It was the foundation for being a physician, foundation for life in general. So I hope you remember who I am. I'm Swapna Dharashukar. I'm currently in Louisville, Kentucky. I'm practicing as an endocrinologist with a private hospital system, and I have gratis faculty appointments as an assistant professor at University of Louisville and associate professor at University of Pikeville, which is a town close by. So I get to mentor fellows and do clinics and do grand rounds, all of which I really enjoy, since I think GS has inculcated in us that you learn, and you really learn from what your teachers teach you, what your seniors teach you, what the patients teach you. So there's so much I could talk about GS, but I know 5 minutes isn't going to be enough, but I'll try to squeeze in whatever I can. I did get the list of questions that Amol sent from Dr. Natarajan, and I think I really could talk about each of them, but I'll touch on just a few, and Amit touch on some later aspects. I would like to concentrate on what was a little bit more unique to me. First of all, why medicine? That wasn't hard at all. I always wanted to be a physician, so that was an easy choice. GS. So coming from Nagpur, GS was not something anybody had ever applied to, wanted to go to, but I knew it was the best college in the state, and that's where I wanted to be. So it was my goal to be in GS, and it was not going to be a cakewalk for sure, because there's so few open Maharashtra open seats, and there was nobody to guide me because nobody from Nagpur had ever gone. So I was happy to be part of GS, because if it wasn't going to be GS, I was not going to stay in Mumbai. I would be in Nagpur in the cozy comforts of my family and my town. So between the time that I clearly remember the admissions process, and I could go on about it, it was, nowhere close to what I hear it is now. It's all online, but we were all grouped in that one big hall, and you were called in and you were given assignments about which college. But anyway, after getting into GS, from the time the admission process was completed to the time the college actually started, Mumbai was going through its usual rainy season. Everything was dark, gloomy. It was raining every single day. There were just streams of gutter water everywhere. And the hostel where we were to stay in Shivdi wasn't very easy to navigate. And I started wondering if this was a good choice. And I started doubting myself. And in those moments when I felt like I was the only person in Mumbai, I knew nobody. There was a distant aunt and nobody else that I knew. I felt I probably wasn't wanting to do this. But at that time, Lopa Mehta madam was like my stoic force. She really helped me navigate through the rainy season, I would say, and through my own emotions. And after that, it was history. I mean, everything about GS, I loved. There was nothing that I ever doubted. It never failed to deliver. It was the best of the best. So I'm glad that I stuck through those times. After 3 months, the rains abated, everything was smooth, and it was wonderful. Everything was great after that. My classmates, my teachers, my college mates, and most of all, the patients, they have taught me so much. I've always considered GS teachers the best of the best. I mean, anytime you walked into the lecture hall, you learned so much, you soaked in so much. There was so much medicine. Not only that, there was so much of other aspects to medicine that you learned that it was a full experience. It was always the best experience. I could devour everything that the teacher said, every experience that you went through, the dissection halls, and later on the ward rounds, the clinics, everything was just, I think, A grade. The canteen Amit mentioned, it was really good. To talk about some negatives, the girls' hostel food was never good, but I learned that I could survive on milk, bananas, and eggs because that was the best thing that we could get in some of the hostel food in the first year, and not much in the second, in the senior girls' hostel either. In terms of being active, I was able to be the secretary of the Marathi Mandal and then also the Festival Cultural Committee coordinator. So a lot of interactions, a lot of learning, a lot of managerial opportunities. I think that was very good. Amol, how are we doing at the time?
Yeah, we're just about finishing.
Okay, I'll wrap up. But all in all, I have to say that it has been great. There's a few things that I do remember. I mean, all my first year teachers encounters were memorable, but I do remember Dr. Shyam Kishore saying clarity of thought and action leads to clarity in action. And I think that one thing has stuck with me all my life, that your actions are really determined by your clear thoughts. So there's a lot of things that I draw from my experiences from GS and from all my patient encounters that I find myself going to GS Times many, many times. I don't know how the college is now, so I cannot say a whole lot about it. I think just one thing that, even though we learned from the teachers, one thing that I think can be incorporated in the first year syllabus, apart from the medicine and everything, is the moral and ethics part, which patient care, I think it's good to inculcate that as in early, how to respect the patients, because they really are everything to what we do. So, I know Mandot mentioned about the preceptorship. I think that was great. Maybe a little bit more support for the people who come from outside. Maybe it's not so big an issue. We didn't have phones. We didn't have anything. So it was a little harder. Maybe it's easier for these kids now. But that's another thing. And then, of course, there's a whole lot more I could talk. Maybe make a Google form of all those questions that Dr. Natarajan said, and I could write so much more. Once again, thank you, friends, for being here. Thank you, Dr. Natarajan, and everybody for this opportunity. I really, really appreciate it, and hope to hear other people's experiences. Thanks, Amol.
Thank you. Vaibhav Dedia.
So good evening, everybody. I can't express my joy on seeing all of you and Dr. Natarajan. And I still remember the day. It was 12 July 1994 when we had our interview, and deans from all the 4 medical colleges were sitting, and they asked which college would you like to join. So I remember Dr. Pragna Pai was there, and I looked very nervously at her and I told her KEM. And when she signed the form, I just, the hair on my back and my neck just stood up, and I was so elated to do that. I joined medicine because I wanted to follow the footsteps of my late father. He was an MBBS graduate from Nair. And from the time I was a small kid, I would hear him tell me, KEM is the best. If you ever get an opportunity, you must go there. So he accompanied me on the day of my admission, and I still have vivid memories of that day when we went to KEM to pay our fees, and we met everybody for the first time. Everything I am today I owe it to this college. I'm a practicing interventional cardiologist in South Mumbai. I remember all the teaching faculty, Dr. Natarajan, Manu Kothari sir, Dr. Lopa Mehta, Dr. Fuyan in the anatomy department, such vivid memories. Dr. Pradeep Vaidishwar, we are still in touch, and from pathology. And in general surgery, it was Dr. Ravi Bapat, then Dr. Tilve. And the clinical skills and the ward rounds, when we started in second MBBS and we started going to the wards for the very first time, it really showed us, why KEM was just apart. You would see the wards teeming with patients, but the senior doctors would individually be seeing every patient so carefully. So the things which we would always read in the books, like inspection, palpation, percussion, auscultation, we would actually see them being done And it was really a wonderful experience learning medicine, learning surgery from such stalwarts, and I think if there was an opportunity, probably a second lifetime, I would still want to come back to the same medical college. My memories of the library were really great. I was not very much into other activities, but the library was so well equipped even in those days, and we had all the latest books and journals available to us. And it was a great meeting place. And for all of us, we would many times be sitting outside the library discussing what we have learned in the classes, what we have read, what are the new things. Those things are still very fresh in my mind. I've really made some very good friends with whom I'm still in touch, and I owe everything to KEM. The hostel, I was never a hostelite, but yes, I there with sit down with them and have a meal with them, especially in the final year, and I would get an experience of what hostel life is. I have stayed back a couple of nights with some of my friends in the undergraduate hostel, and I think for them to stay away from their homes and still manage to study so well and do well in exams was really a commendable thing. Uh, the teachers have been very inspiring, and I think we still all remember them for the ethics which they taught us and by the principles by which they stood. And especially I remember I remember Dr.M.V.L.Kothari very vividly, and everything that he would speak, so he put us so much at ease even on our first day. uh, uh, the cultural festivals and Avishkar we did all attend, yes, and although I was not part of the organizing committee, we would like to attend everything, and it was a new experience for all of us. I think in terms of what GS was then and what now, I think we have made a lot of strides, and we did not have so much exposure to digital technology at that time. I think the internet and all was still something which was in a nascent stage at that time. Social media was not there. In fact, we did not have cell phones as well. I think only one or two people in our batch had cell phones towards the second or third MBBS. Still that time was time when people used to carry pagers and would rely on a landline. So even if we had to plan something, we would call each other on a landline one evening before, plan where we would be meeting and what we would be doing the next day. So the advances in the digital technology with the time, I think definitely it has made education more simple, and the connectivity far better. So I take this opportunity to thank all my teachers. I have taken the name of a few, but I remember each and every one of them, and I thank them for everything I am today. And it's really a happy moment for me to see all of you. Thank you.
Prashant Kerkar.
Hi, thank you, Amol. I would first like to start paying huge respects to Dr. Natarajan sir, and also all our teachers throughout our first, second, and third MBBS. I think what we are today, whether we are successful, how far we have gone, is all thanks to what they have taught us and what we have learned from them. So I'm going to make it brief because I have really very sketchy memories of college as it was many years back. But I became a doctor because both my parents were doctors, and the only thing I knew about was becoming a doctor. So currently we are 7 doctors in the family. All my sisters are doctors. So that's the profession I knew anything about. Why GS? Well, no secrets about it. It was the best college I think in the country, if not just in the state at that point in time. And after going through Parle Tilak Vidyalaya, Ruparal College, KEM was the next destination. What I loved best about KEM is the camaraderie we had amongst all our friends, the entire group. I think most of us interacted with each other and had very good times, whether it was the PMTites, the hostelites. We had a wonderful time in each one of them. Some of the memories that I have is the first is being completely lost when I joined MBBS in KEM. The first few lectures were all like thorough bouncers, trying to understand them, trying to understand the anatomy, physiology initially was a tough task. I still remember the first viva for what the bones that I had, what was with Dr. Manu Kothari sir. And I think looking at my face, he realized that I was completely stumped. So rather than taking my viva, he picked up the bone, he described the entire bone to me, kept the bone back and said, "You are done." So that was a wonderful moment. And I really felt saved by him at that particular point in time. During my MBBS, of course, the teachers during our first year, whether in anatomy, physiology, or biochemistry, I think they were one of the best. And the reason I say that is because the kind of lectures were taken, if you were attentive, I think the entire syllabus was so well covered that your work at the time of exam was really cut down to just revising a few things. So I sailed through my first, second, and third MBBS, and I was sure I'm going to become a medicine doctor. Like my father was a pediatrician, my mom was a gynecologist. So I thought I'm going to take physician going to become a physician. And I was scared that being a surgeon, I might not be able to, I might just cut the wrong thing and be severely punished for it. But as luck may have it, I was introduced to Dr. Arun Samsi at that point in time. And he was such a wonderful teacher that that is the interaction which led me to believe that a teacher can really change you or let you have confidence in what you're doing. The way he taught surgery to me during my interactions with him, I had decided that this is what I'm going to become. And fortunately, I could get a seat in MS General Surgery. Then subsequently, I went to the Tata Memorial Hospital, where I trained in surgical oncology. Again, thanks to each and every of those teachers, they have all contributed in some way or the other in making me become what I am today. So currently, I am practicing as a surgical oncologist with special interest in hepatopancreatic biliary and colorectal surgeries. I do minimally invasive surgeries as well. And this I do at Bombay Hospital, Breach Candy, and the Hinduja Khar. I'm a part of the DNB surgical program also at the Bombay Hospital, where I get to be the teacher and we have students under us. So I try to inculcate or try to emulate my own teachers, which I had during my MBBS days, MS days, and try to set an example for them. And I hope I'm successful and I can make impress those facts upon my students. So once again, I would just thank GS and I would thank my stars for making me a part of the GSMC and the KEM hospital. And I'm truly obliged to all the organizers for this particular event. Thank you, Amol.
Thank you. Nishigan Devle.
Thank you, Amol. So I'm Nishigan Devle. I'm at the moment working in England. And I'm working as a fetal medicine consultant. I'm also a consultant obstetrician. So those are my two skills. I'm also the clinical director for obstetrics at my trust, which is a big trust covering a big geographical area of East Suffolk and North Essex.
A bit louder, please.
Can I be louder? Okay. Did you hear what I said? Or you want me to repeat?
Yeah, fine.
Yeah. So why did I choose GS? I would say I was not even destined to be a doctor. I would say if somebody would have met me halfway through my year 12 and asked me, would you be a doctor? I think my answer would have been definitely no. But I don't know what happened. I became a doctor by accident is how I would put it. And because I got the cutoff marks that I would need it to get into said GS. So, and that was the logical choice for anybody because that was it was known as the top institute in Mumbai. So I was in GS. I still remember the day of the admission. It was a very rainy day. And because we lived in Thane, I traveled with my mom and we traveled really early. So it was like a very long day at the end of the day when the admission process was done. First impression of say GS, I think I was really, I would say, overwhelmed by how big the place was because, you've been to junior colleges and things, you've never been into massive buildings like that with all the history that, GS has. So that would be my take on admission process and things. In terms of teachers, I would say I'm very, very grateful. And I would say we have been very, very lucky to have teachers like what we had in year 1, year 2, and year 3. I would say I've got more memories of the first year because that's the year you probably everybody probably remembers the most. I would think I would fail to believe anybody who has to say something different. And I still remember the muscles of the hand, which Dr. Natarajan taught us, and how to remember how many muscles and what order is 41365051, which incidentally is the KM hospital telephone number. I don't know whether it still is the same or whether it has changed with time. But for some reason, that is very well etched into my memory, even today, so many years later. And I also remember Dr. Natarajan, kind of, you know, when you get really good marks and you feel like, oh, you're going to be a doctor. On the first lecture he took for us, like in whatever, we were in like different groups, and the short group lecture he took, he told us that some of us are going to be here for 11 years. And at that time, I felt like, oh my God, is it going to be 11 years from today that we're going to be walking out of this place? It seemed like a very long time. Luckily for me, it wasn't 11 years for me, and I only did a undergraduate and postgraduate from KM, so it wasn't that long. But I must say that we have learned a lot from whatever was taught to us, and the way anatomy was taught to us. I think that is what makes a difference to some of us who have been surgeons or practicing, and still from in day-to-day life, the whole concept of practical application of anatomy rather than just remembering structures is what I think has made the difference of where we are today, is how I would put it. What else? In terms of memories of the college, I must say, yes, we had good time. And I must say most of my time from between year 2, year 3, and even my internship, I've spent with 2 people who shared the first initial surname as same as mine. And I remember us being remembered as the 3Ds, Vaibhav and Ashwin. And I've spent a lot of time with them. I've spent time with other people as well. I must say my single most biggest regret about how I spent my time in college at the time is to not being, although I did attend all the social events, is not kind of spending time organizing things. Another time, I think my priorities for some reason were different. And I think that is one of the biggest regret I have, that maybe if I was to live that time all over again, I probably would have spent more time organizing in social events and things like that. In the I would say in the grand scheme of things, in the long run, studying a lot at that time did not make a difference. And as I can see, a lot of us have, are where we needed to be, and probably spending more time that time and enjoying life at the moment is more important than worrying about the future, would be my advice to junior colleagues in this meeting today. So yeah, I think that's about it really. I don't have anything more to say without taking more time.
Thank you. Ravi Kiran. Dr. Ravi Kiran. Yeah, I think, yeah. Dr. Ravi Kiran, are you there?
Yeah, Amol, can you hear me?
Yes, yes.
Hi, everyone. It's nice to see everyone. Because of WhatsApp, we don't realize that I've not met a lot of you for 25 years, maybe more. It's nice to see everyone. Thank you for the opportunity, and hi to Dr. Natarajan as well. I am currently in Perth, and I head intensive care unit in one of the hospitals here in Perth. In KEM, and I was in KEM for 15 years, which is like a dream for anybody who enters GSMC. So I did my medicine and was a lecturer for 4 years. And then I moved to Australia to pursue intensive care medicine. In terms of memories, listening to all the colleagues who have spoken before me, it really brings vivid memories for the first, second, and third MBBS. From the first year, what I can remember really is the Department of Anatomy and how they introduced us to MBBS, which was probably different from rest of our colleagues in other hospitals. And the art of medicine, which Dr.M.V.L.Kothari used to always say, and the way Dr. Natarajan approached anatomy, that really changed the perspective. The concept of 3Ds, which was dedication, discipline, and determination, I still use it to teach my students currently. In second MBBS, really what is etched in my memory is the canteen, katta, cricket, and treks. And I have really good memories with all my friends, lot of photographs. All of them are stuck with me now. So I've just recently back from New Zealand, trekking all the way, and I still play weekend cricket, scoring half centuries. And from third MBBS, my memory is Dr. Medekar, who was my PG guide as well. And all his teachings and beatings are still with me, and I use some of his tactics on my students here. How the college is now, I'm not been to the college for last few years, but I do get updates from my colleagues in Department of Medicine and some of the students with whom I'm in touch with. And it seems the college has changed quite a lot in terms of the facilities and the activities that they're doing. Just a short story. Recently, we have something called as Australian Indian Medical Association here, and we had an annual ball. And I was sitting in a table. There's some another stranger who came to the table. We introduced ourselves, and it turned out to be he was an ex-GSite, ex-medicine guy from KM, who was 9 years senior. We started introducing slowly, and after 2.5 hours, we were laughing all the way, discussing all our stories from KM. And he had wine on his t-shirt, and I had wine on my t-shirt. So that's what happens when two GSites meet anywhere in the world. So that's my bit. I won't take any more time. Thanks, Amol.
Thank you. Kirti Kumar.
Thank you, Amol. Respected teachers and organizers and my dear friends. First of all, I would like to thank that I'm getting a chance to speak with my colleagues. Thanks to Natarajan sir and of course Amol, you as well. In 1999 or 2000, after finishing MBBS, I went for doing MD pathology from Nair. In fact, I was not at all serious in studies in KEF, but I became serious in Nair. So I can say that I have a very good memory from KEM to cherish than Nair. Now I am currently practicing pathology in Ratnagiri, and I own my own diagnostic center. And I'm happy to say that I'm like a I'm like a family pathologist for the masses. It is a bit new concept, but I have my practice in masses. So I'm happy that all the knowledge and our basics, which I have acquired in KEM, as well as in Nair, of course. Now, regarding the memories, everyone has talked about the college, wards, library, different places in the campus. But I would like to talk about the place where we spent more time than you guys. Because the guys who were doing up down from Mumbai, they were hardly 8 or 10 hours in a campus, but we were staying in the campus 24 hours into 5.5 years. And of course, we have more memories about our hostel life. I was hostel secretary for more than 2 years. In fact, we all people from hostel, we were very well connected. We had adverse conditions also, but we actually learned to live in the adverse conditions and also adjust with everyone. We were very much social with everyone, and we were understanding everyone's problem. And of course, I myself tried to help everyone also at that time. And even I was helped by others also. I think these are the qualities which I learned more in KEM Hospital and GS Medical College, and it has helped me a lot in my practice than my academics. And I'm thankful for everything I got in my hostel life as well as in my college life. Now I have not visited my college for more than I think more than 10 years. I have not seen the campus, but I'm sure all the like memories will be there in place. Apart from the building must have changed. Thank you. Thank you, everyone.
Thank you. Kailash Pawar.
Hi everyone. So my name is Kailash Pawar. I am at present. I'm a pediatric neurologist. I practice in Kansas City. My funny story is, so obviously I had no idea of what KM or GS was till I passed my 12th grade. And so my primary care physician there in my town said, you got good marks and you should become a physician. So that's how I decided to become a physician. So the first day when I stepped into KEM and those big buildings and a lot of these happy faces, and I thought I'd made it. And then I remember the times when I sat to the anatomy biochemistry lectures, and for the first 6 months I was like, what have I done with myself? Because I had no idea of what was happening, and I struggled to the first year. But the best part was, I had made good friends, my teachers. The common message was just stick around, you'll make it. And so that's how I made it through my first year. And once I passed my MBBS, I got into KEM pediatrics. I had a wonderful 3 years of pediatric training. And then I thought I'm going to come just join KEM, work as a pediatrician here. But something changed. And then I said, maybe I need a little bit more training. And that's how I ended up in the US, did my pediatrics again, neurology. So my specialty is epilepsy. So my practice is mostly refractory epilepsy in pediatrics. That's what I do. I also am part of the Pediatric Epilepsy Fellowship. So I'm the co-director. So I'm involved in training pediatric epilepsy fellows. And I also was trained in monitoring of spinal and posterior fossa surgeries. So that's one of my other niche things that I do. Going back to KEM, there are a lot of fond memories, but I have a funny story that I'm going to tell you, and that involves Dr. Natarajan. So as I was telling you, I was struggling. So we had this viva of our lower extremities, and I had no clue of what was happening. So Dr. Natarajan was being nice to me, and he kind of, he asked me a lot of questions, and I didn't answer a single one. So he said, and then he handed me a patella, and he said, if you tell me if this is the right or the left patella, I'll pass you. And guess what? I guessed it right and I passed my exam. So it was a very funny moment then that how he was trying to be so helpful. And the second memory I'll tell you is during my first final exam, during the histology slides, Dr. Lopa Mehta was there, and I was getting everything wrong. And so I thought it was the end of my thing. I'm not going to become a doctor. So after the exam, she comes to me and she sits down with me and she went over all the slides and she explained it to me. And then at the end, she said, it's not that you don't know, it's just that you're taking too much of stress. So you just have to relax. And that was a big thing, I was living alone in the hostel at that point because my parents were out of the country. So my support system was my teachers, my friends. A lot of my good memories from the hostel life and from the college life. Other than that, my only advice to the youngsters is I think a lot of us took a lot of stress in life that at that point is how much we wanted to do well. And I feel like if you put in a decent effort, enjoy the rest of your life, there's so much more to life than just studying. You'll end up becoming a good physician, a good human, and I think that's what we should all try and do it. I think that's about it. I don't have anything else. Thank you.
Thank you. Ujjwal Rathod. Dr. Ujjwal Rathod.
He needs to unmute.
Uh, Hello everyone. I am audible now.
Yes.
Yeah. I am still working in the SGS Medical College as an associate professor in the Department of Pathology, and I am specialized in the GI pathology, and also working as a consultant in the most of the private in the Chembur area and Matunga area. And I was in the student council. I was a cricket secretary in 1997, and most of the part I enjoy in the game is only cricket most of the time, and I am still now the vice president in the cricket, and most of the our batchmate who are our 94 batch is our strength is a unity, and they used to listen to most of their captain, and that's why we used to put our two teams every time in the our inter-class tournaments, and because of our unity and the strength we used to we won most of the tournament in the KM hospitals. And other memories are the like in our batch, I saw the few people who are like more intelligent, I say, and they are talented. We called as a inborn talented people, like I say Ejendra Gavi, and then the Charu Barve, and Rahul Chinawle, and Prashant Sende. These people, I don't know where they study, but whenever I remember one in the first few days of the first MBBS, when Sham Kishore and sir handed over some femur to the Edendra Gavi, he spoke around 1 hour on that. So that much talented we have in our batch, and I very thankful to my friends like Chandrakant Chapte and Ram Singade, who used to be with me every times. And I remember some first memory as we had went to the hiking to the Kalsubai. That was a great memories. And other memories are the like we a few people are always disturbing in the class, and for that we got the punishment to present the seminar in front of the all the students, and that was a good memory too. And I also used to stay in the hostel, so there most of the guy we used to play there in the cricket, and enjoy and go for the lunch and everything. Thank you very much.
Thank you. Harshal Nimkande. Harshal.
Hi, good evening, everyone. Hello, Natarajan sir. Hello, am I audible?
Yes.
Yeah, audible. I had muted myself.
Hi, everyone. Hi, Amol. Hi, Ujjwal, Ishigan, Kailash, Ravi Kiran, Kirti Kumar, Prashant, and a lot many friends who are there on YouTube as well. Now, I am Dr. Harshal Nimkande. I am a practicing pediatrician and neonatologist practicing at Kalyan. Now, how did I become a doctor? Because it was decided from earlier days only. You should become a doctor in the family because nobody's in as a doctor in the family. And my father used to take my grandfather to the hospitals, and he used to wait for a long time for the doctors, and then he decided that my son should become a doctor. So this is how I decided to enter in the field of medicine. How choose GS Medical? Because it was one of the best colleges, and I remember all the teachers and everyone. The thing is, second year I don't remember those many teachers, but first year and third year I do remember all of them. I won't be able to take name of all of them, but by face I can recognize. Memories about teachers. GS taught us not only medicine, the ethics, but it also gave us a lot of hobbies, like trekking is one of them. A lot of us used to enjoy that thing along with our teachers and our teammates. We used to play cricket, we used to play badminton, and those have lot of memories in us. And in this stressful life, that's how we learned to enjoy the life as well, along with the studies. Especially about the teachers, teaching experiences, how it changed my perspective is a simple example. Dr. Manu Kothari, he used to say that milieu interior is actually milieu exterior. So that's how it gave me the impression that, yeah, it can be other perspective as well, because the mouth and anus is connected, so it is exposed to the exterior thing. So it's actually interior, but it's exterior. Another thing is Dr. Tilve used to take us to the rounds, and which I still remember is the patient he's demonstrated us in the ward. That was, I think, psychiatry ward. That was a dark room, and it was a patient of rabies. So there he demonstrated all the signs and symptoms. So I still has an impression, and I still remember those things. Dr. Karna, Dr. Supe, we enjoyed trekking, going to trek with them, and a lot of fond memories about the hostel. Hostel life was good. It gave us, like, it told us how to live in the adverse conditions, as well as it gave us, like, you can say some kind of discipline, even though our room used to be very messy, but thoda discipline aa gaya tha, ki how to do things on your own. And those were the great days. And I think the changes which have taken place, the most significant change which everyone noticed was the audio. The audio is being shifted, and that was for good, I'll say, because in front of the dean's office, the toilet which we used to have, that was not really good. And I think that's it. And a lot of like katta we enjoyed a lot. Everyone used to sit on the katta in front of the canteen, enjoy the sip tea with sip by sip, and then do bird watching and do everything. I think that's it. I have many memories, and I'm very grateful to my institute and all the teachers, all the colleagues, everyone. It made me who I am today. And once we interact with the other doctors and colleagues, this is my personal opinion. It can be wrong, but what I feel is a GS site stands out differently. Means I think evidence-based medicine, ethical medicine practice, it's very much in the blood of a GS site. I may be wrong, but it's my personal opinion. Thank you, everyone.
Thank you. So now I'm the last person remaining to speak today. And at the outset, I wish that if we could go on till 7:30, and after I speak, if there are any other batchmates who would want to speak, they are welcome, of course, with permission of Dr. Natarajan. I am Dr. Amol, and I have done my MBBS and MD in internal medicine from GS Medical College. All of us who have done our UG in GS, it's such a remarkable feeling. It's very difficult to forget. It's very difficult to describe it in probably 5 minutes. I always wanted to be a doctor, but then my plan B and plan C were also very interesting. I also wanted to be a chef had I not become a doctor. And after my 12th standard exam, the time which was spent in the summer vacations, my friend's sister was actually a medical student in JJ, in GMC. And the kind of stories that I had heard from her, I had made up my mind that I'm going to join JJ only, because the way she described it, the fun and everything. But then eventually, during the admission process, I chose GS Medical College. all of us will agree that first year has a big impact. All the three departments, anatomy, physiology, and biochemistry. Anatomy definitely is the main department. All the teachers in anatomy, especially, they remain etched in our memory. We all have spoken about Dr. Natarajan, his inimitable style, Dr. M.L.Kothari, Dr. Lopa Mehta, and all of them, including, we have teachers from physiology and biochemistry. It was fun being with them. All of us remember time spent in the college canteen, in the library, the famous katta, and, participating in social events. I too was a hostelite, spent my first year in the Naga hostel, followed by the boys hostel in the campus. What Dr. Harshal did mention just now was it is the quality of the training, the values that our teachers inculcate in the students, and doing the basics right, which help you later on to be a good doctor and continue to excel in your field. I wish that I could relive those moments again. Our batch is in touch with each other. We recently had our 25 years reunion. Most of us could be able to visit the campus, and it was really a happy moment. Made some great friends from undergraduate days, and we are still together. We meet very often. All in all, I feel that it's really great to be a part of this great institution. When you go to the college now or the hospital now, things have changed. Most of the buildings remain the same. One thing which stands out is that it's more crowded. Because I did my MD medicine there, I try and visit the EMS and the Ward 4, etc. Very difficult scenario, very, very crowded. The number of staff and doctors should increase. Residents should be able to solve their problems. Well, that's a different story. But I'm happy that today we are all over here and able to connect with each other. And I end my talk. Anybody else would like to speak with permission of Dr. Natarajan or the student coordinators, if you would like to ask any questions to any of the participants? Thank you.
Yeah, you can go until 7:30. Okay.
Yes.
Yeah.
Anybody else would like
let everybody be comfortable.
I have a question for Dr. Natarajan, sir.
The students can
okay.
Oh, fine. Let me hope I can respond. Okay, go ahead.
So, sir, I would like to
Please
know
go ahead.
What made you go to medicine and do anatomy specifically, and your style of teaching. Who inspired you? Because we think it's, the whole department of anatomy has a very unique style of teaching. They don't just teach textbook style. There's so much wisdom to everything you say, so much art in whatever you say. You treat the body as, something to be revered. So every single teacher in anatomy, I think they made us realize that it's not just the facts. There's so much to the human body than what is in the textbook. So could you please tell us what inspired you to do and what makes you such a good teacher?
See, basically, we all at the GS are all top rankers from the state. Okay. And we have a base with, we have to build up on that base. So in that context, like all of you, I'm the first medico in the family, so I happen to land up into this profession. Okay. Then teachers, as all of you have put in, the teachers of my time from all subjects, in particular anatomy and surgery, because I did my MS General Surgery also, based on interest in anatomy. And then I switched over back to anatomy because I was not very happy with the modes of practice. Okay. And having done surgery, okay, for anatomy and surgery are inseparable twins. Okay. So that, since I was the first medico from a family, I said 180 students were getting admitted, 200, now 250. There may be some who are joining medicine for the first time. Okay, whereas people from medical families, they don't require any data vis-a-vis how the world is vis-a-vis medicine. So in that context, that being first in the field has its own charm in any particular branch. So then whatever difficulties I had, I have to see that, meaning that in general, everybody will have the same difficulty. And anatomy is all Greek and Latin. Okay. So in fact, there's a book by Medical Dictionary. Okay. Which, and nobody reads dictionaries like textbook. You just refer to and come back from it. You have any word you do not know. But somehow, thanks to all of you students, etc. Okay, the questions the fresh brains ask 18-year-olds. Okay, so then I was ashamed that I've become a general surgeon, and I didn't know how the word anemia was derived. Okay, and when I saw Dolan's Medical Dictionary, I learned that EM, just the 2 letters, or AEM, depending on British or American English, means blood. Okay, and is negation, and hemia, H drop. Okay, and A also drop in US English. So EM just means blood. So that's sort of stimulated and started reading the column wise, one column a day. Dolan's Medical Dictionary. It took me 5 years after joining anatomy to complete that. And by the time you had come in, I had completed Dolan's Medical Dictionary. Okay, at the rate of 1 page per day. And then fresh brains coming in there, and fresh brains are very interesting because they don't take anything for granted. Okay. And there is a saying, if you're a pediatrician, you become a child, constantly interacting with children. If you're a psychiatrist, sometimes it says, well, somebody says that when the psychiatrist and the patient are interacting, you don't know who's the psychiatrist and who's the patient. Okay. So similarly, we are interacting with the top brains. Okay. So technically, it's a mutual interaction which takes place. And then Dr. Kothari handed over a book of etymology by Eric Partridge. Okay, short etymological dictionary of English language. So having you are all graduated and gone by the time. Okay, so another 6 years over that. And practically, it's basic question is life, and answer is death. Once there is an answer to a problem, that means there's nothing beyond that. Okay, so the constant questioning interaction, and that's very much there in all of you. As freshers, when you come in, every brain thinks uniquely. So I think maybe these are all the things which contributed, constant interaction. And now, even to this date, I'm open to, okay, a viewpoint, any viewpoint express. That's how conducting a Viva, you all may be feeling I'm conducting an exam. No, for me, it was not an exam. Just trying to find out what your brain is able to perceive and what have you learned in that process and what I can learn from you in that particular point in time. Okay. So anyways, I'm sorry, it's more of your batch meet, and therefore I would like your batch to get the time to speak. Okay, anyways, thanks.
No, thank you so much. We really appreciate all that. It was great to hear you talk again. Took me back so many years. I think we were really privileged to be your students, learning from all of you. We were privileged to have the dissection bodies and, learn from the body itself, which I think is something that we should respect, that somebody's, body is able to teach us what we learned. I appreciate all of that. And I also think the exams were very, very thoughtful. I still remember this one question because they were not theoretical exams, they were derived. So one question was, and I think it was a little gory, but that a person was shot in the chest. Which structures did the bullet pierce through when it went maybe like 4 inches or something like that? So we had to think from, it was I think it was second intercostal space. So you had to go through thinking about which all structures it would have gone through, which was a lot of derived thinking, not just rote learning. And that has made us the folks we are today. So thank you, Dr. Natarajan, sir.
And please note, nothing is unilateral. It's always bilateral. It's the interest of the student, interest of the teacher. Okay. The greater the interaction, greater each one is trying to understand the other. Rapport, in short. Okay. It's better for both. Okay. That way. Anyway. Others.
That is true. I think people of a kind, find a way to be together. And I find that mostly true for institutes, that, as GSites, we feel like, all of us feel like we are so similar in our thinking. Somehow self-selection brings us to the same place, that we all wanted the same thing. We all did the same things. We wanted to strive and work hard, which makes us very similar, which is, I think, the beauty of all of these good colleges.
Yeah, we have Dr. Surendra Kumar, who has just joined.
Yeah, welcome.
Dr. Surendra Kumar Sonar, please unmute yourself. Dr. Surendra, are you there?
Amol.
Yeah, Dr. Rajesh, hello. I've seen you also. Yes.
I will like to speak also. After, let Surendra speak. After that, I will also speak.
Hi everybody. I'm hello sir. First of all, good evening.
Hello. Good evening.
Hi to everybody, my colleagues and juniors. I am Dr. Surendra Sona. I have done my ophthalmology from KM Hospital and done my fellowship in pediatric ophthalm and strabismus, and now practicing in Kalyan, having my own center at Kalyan. Regarding memories of my KM, I joined KM because of my parents and myself also. I was also interested in joining because I was the first person from my whole family tree to become a doctor from my family member. So everyone was happy that day. 1994, it was a year. And the thing was that the KM was like a temple, which was very silent but huge. And we were, the students, we were ready to run in the temple run. But I used to jog in this temple because I was very average in the studies. I used to enjoy much of time in trekking, playing cricket with our colleagues, RK, Harshal, Amol, Kirti, and all that. And we used to enjoy lots of other activities other than studies in KM. I was also in a hostelite, and in hostel life it was very different. We used to do lots of extracurricular activities during Avishkar and other festivals also. We used to participate in intercollegiate tournament also. Our captain Ujjwal Rathod, Chandrakant Chapte, they were used to be a huge success for our college. We had one cup during our tenure. Lots of fond memories in our days. I used to describe some doctors, some teachers of our days. Just I remember them. Dr.M.V.L.Kothari, he was a Dada Muni with lots of lecture with Gujarati Tadka in it. Lopa madam was like a mother who is taking care of the children. Natrajan sir was am I audible? Audible, sorry. And had a style and lots of intelligence. He was an warden of our hostel also. And I remember that he used to remember my room every time when I passed him, because I was to change my room because I was often I was not doesn't get a room properly. So he allotted me one room one day. So thank you, Natrajan sir, for that. SK sir was a genius. Then Bhuyan ma'am was always smiling. Amankar ma'am is always saying it's okay. Oskeri sir used to ask us to sing a song in their lecture. Tripathi ma'am was having a killer look. She always used to fail me in exams. Udi sir was athletic and used to enjoy trekking. Chaudhary sir was always joking in their lecture. Gopte ma'am was very graceful and beautiful. Supe sir was a very smiling surgeon. DRK sir was a Buddha with a wisdom. And Bapat sir was a skilled hand without instrument. And last man, the Stu sir, a man with a mask. In short, there were lots of fond memory in our days, but these were very short. I was very average in my studies during first and second MBBS, but my teachers and my colleagues, my friends helped me in third MBBS and cleared my exam with very flying color, and I got ophthalm. And I'm doing very well in my life. I'm happy. And I asked all my juniors to enjoy your life, enjoy your studies. And GS Medical College has given me lots of things, lots of things. My friends, teachers, and lots of memories. So in the end, I thanks everyone for the what they have given to me. Thank you very much.
Dr. Rajesh Machewar.
Hello, good evening, everybody. Respected Natarajan sir, all my dear friends. I think being in KM was a privilege, and that privilege I realized more after I left KM. Everybody appreciated so much. MBBS from where? MBBS from KM. Oh, such a great institute. One person said that if you want to do the MBBS, do it from KM, otherwise don't do it. He was such a great fan of KM. So this institute has great history, and we also realized that the teaching pattern of this KM was unparalleled. No such MBBS college. Now I have seen many colleges, but not a such single college is there which can compare, or is KM is a benchmark in the teaching in MBBS Medical College. So I feel proud to be a GSite and KMite. And I came from Nanded district. Being in KM, it was a first visit to Mumbai also. So it was a double feast for us. Mumbai, such a metropolitan city, and the best college, GS Medical College. The memories from first year, I think hostel memories were there. Patankar sir was our warden in Naigaon hostel. We used to see the movies, late night movies till 2 a.m., 3 a.m. and to wake at 7 a.m. and to rush for the first lecture at 7:45 to the KM. It was everything was fun and also horrible at that time. The lectures, I think introduction anatomy was the best part of the first year. Lopa Mehta madam as a mother figure always used to care for the students which are specifically from the outside the Mumbai, those who are staying in the hostel. She used to take care personally and tackle our problems. Second thing, Natarajan sir, what a great style of teaching he had. And he used to, during dissection, he used to imagine in lectures 3-dimensional, and many of the times all his lucid fluent English language and his imagination, most of the times it was above head, our head. Hardly at that time it was difficult to understand what he was teaching. But in day by day, we realized that his ideas were so clear, and he tried to teach in that. Dr. Shyam Kishore was really a gem, and M.V.L. Kothari, he was, I think, like Amitabh Bachchan. His lectures were feast for us. What many literary words the first time I heard from his mouth, Michelangelo and all that. CNS, central nervous system, used to describe like CNS's nervous system is like a tree. Spinal cord is a stem, and the upper part, roots are like the peripheral nervous system, the root, and brain is the leaves and all that. He used to explain in such a poetic and literary way. We used to enjoy his lectures, though. And in second year, I think there was not much, because we were much more interested in trekking. Trek was a very good part. Trek to, I think, Kolsubai, I still remember. In that time, Dr. Shenai was there accompanying Dr. Supe, Dr. Karnar sir. Our seniors, Parmeshwar Gond, he was, I think, most of the treks he used to organize. And hostel life was a best part. There I got many friends. Our Miss Madhukar Dhonji, Dilip, KP, Suri, then Amol Pawar, all the Amol Zhante. I had wonderful memories. And we used to arrange the video movies also. That was also very hectic schedule. Everything, I think, KM, Appa Ki Bhurji, everything. And special dinner, lunch on Sundays. So at hostel mess, it was everything had a great memories. I think to cherish all over the life. KM was the best part of my life. I really got good friends there, good teaching there, and I miss KM very much, and I miss KM friends also. I will like to connect many of the friends. We chat, we call on phone and meet also whenever the opportunity gets. But KM has given the very nice memories in my life. It has a very utmost best place. So thank you all good teachers and good friends of KM. I'm proud to be a KMite. Thank you. Thank you, Amol. Thank you, Natarajan sir, for giving me opportunity to talk and arranging this nice program. It was I think down the memory lane. I felt very good today. Thank you.
Thank you. Thank you, Rajesh. So Dr. Kirti Kumar or Dr. Prashant Kerkar, anyone wants to speak? Do the students have any specific question to ask?
I think you have covered all.
Yes, Vaibhav. Yeah, go ahead, ask. Sejal.
No, I think all of you have covered in such a nice way. With the base of questions.
Wonderful time. And in the... Thank you, sir. Thank you.
Some
The student coordinators, it would be great to hear a couple lines from you about if you have any thoughts or questions for any of us. I know we're probably 25 years apart or maybe even more.
The student coordinator has just become senior.
It was
Yeah.
really inspiring and amazing to hear all the experiences from you. And I just had one question, like what was the most innovative carried out by a batch which you remember, innovative experience?
Amol, do you want to take that on? I don't think that we did anything innovative back then. We were initially, most everybody was on survival mode, and then for the first 6 months, getting to know the system. A lot of batchmates were probably hostelites, trying to adjust. Some from all India, the PMTites were coming. I don't see any PMTite in here, so we didn't get a chance to talk about them. But these kids were coming from all over the country. So there was a lot of survival mode and getting to know the system initially. And then once you settle in, we had a different system than what you do right now. We had first, second, and third MBBS, each of a year and a half. So plus interspersed with all these social activities. So there was social activities plus studying, and then really just following what the patterns are in the already existing system. So I don't think, I cannot remember of anything different that we did other than just carry on the traditions that were already there. There were a few different changes maybe during our tenure, but if anyone else wants to chip in about innovations. But yeah, if there's something I'm sure that the college needs now that we as a batch can help out in any way, I'm sure most of us would be up to helping the institution that gave us so much.
Yeah, well said, Swapna.
All right, ma'am. Thank you.
Well, just a minute.
We could relate.
We have one more batchmate join. Alka, are you there? Yeah, Alka, you can speak now.
Hi, Amol. Sorry, I joined in so late. Good evening, Natarajan sir. And hi, everyone.
Welcome.
Guys, student coordinator, I'm really sorry. I know you were winding up, but when you asked that question, I couldn't help, but I had to jump in. we did something really innovative. We got Falguni Pathak for our Avishkar. We paid 1 lakh 25 years ago, and we were the proudest batch to have generated so much money for Avishkar. And why I know that is because we were one of the batches who made our catalogs ourselves, and we went from pillar to post trying to get it because liquor stores were not allowed as a principle at that time. None of those sponsors were allowed. Colas were not allowed, and there were lots of restrictions. So that was to answer your question. Who am I? I'm Dr. Alka Subramaniam, Nee Chugani, of course, from this batch. Currently, I'm in a faculty position. I'm a psychiatrist at Nair Hospital, and I've been there for almost 2 decades. And everyone has said lots and lots of good things about GS, which, of course, is undoubted because it sets our foundation. But I'm going to tell you a few things which are probably anecdotal and a little maybe different. So first, let's start with Natarajan, sir. And sir, as all of you know, he's this great memory bank who remembered each of our hostel rooms. Every time he bumped into us, he would say, okay, you're from 1994 batch, and you used to stay in this hostel room, and so was your parasite. And I was like, listen, I don't remember my own parasite, sir, but sir would know the hostel like at the back of his hand. And whenever we bumped into him, whatever time it was, after 10 years, 15 years, he was able to recall that. And another thing about sir, in Avishkar, we had a debate. I was the literary secretary, and we called him as a judge. So there was one more judge, and there was sir. So when the judging time came, we got the sheets, and sir had given 8 marks to both. So obviously it was left on the other judge's responses for the person to get it. So we asked him, sir, why did you do that? So he said, see, 5 marks to come and participate. 1 mark if you open your mouth. 1 mark if you give 1 point. And 1 mark if you're able to refute your partner's point. So it's 8 marks per person. That's only very fair. And that's how fair sir was, even when he was marking us for our vivas and our tutorials, which of course, like Swapna said, that when we had our part exam, it was the first success or failure for all of us, because we all came from excellent backgrounds. We had scored fantastically in 12th grade, and suddenly you're hit with this part exam, which you're like, oh my God, what? What are you talking about? You never taught us this in class. Why are you asking me this question? So the intercostal question that she's telling you is so etched into all of our memories, because I think except for Satyan Nichani, nobody else could even envisage that very well. And maybe our 3Ds, that's Dedia Devle and D'Souza. So that's what it was. And of course, Manu Kothari, so I really feel so sad that all the batches have not been able to experience sir, because sir was an experience. He was the first person to tell us in GS Medical College that don't run after Ds, you're only degrading yourself. And that has stood with me like a stamped mark. Not that all of the people you haven't met this evening are not successful. They're all very, very successful doctors. But telling us that in the rat race, don't forget that you become the rat, was a very important, really important lesson that he taught us, as did so many others in our foundation years. So yes, the first year teachers we were very, very close to, and they set the path for us. We did Avishkar. We did Avishkar in a very lavish way. We managed to generate a lot of funds. And we not only had the cultural aspects, as all of these boys have spoken, there was a lot of focus on sports also. And I think it was the first time that we even attempted having intercollegiate sports tournaments and things like that, which were going on in our Avishkar. And of course, a lot of us made not only friends for life, but also life partners for life. So GS is something which gives you love all around, and I'm not just saying that it's your partner, but these are memories that you take with you. And everybody there, be it the peon, the ward boy, the canteen, everybody knows you once you're part of GS. So for example, my husband too, we both met each other over there. And he happens to be the head of retina at Bachuali, which is opposite. So often he comes and has tea over there. And I happen to go after a very long time because I used to be on the ethics committee there. So Shetty in the canteen looks at me very suspiciously when I went the last time. That was a few years ago. And he said, तुम अभी तक सैक में है? So I was like, what are you talking? So he's saying, तुम्हारा शादी उसी के साथ हुआ है तो उसके साथ ही है. I said, shit, तुम क्या बोल रहा है? So he's saying, नहीं, आजकल हम सबको देखता है और तेरा आदमी को देखा है किसी और के साथ. I said, yes, he must be giving tea to, does not mean that I am not still with him. Rest assured, I'm very much married. So this is the kind of relationships that GS gives you. I have been faculty for 2 decades at Nair, and I'm very much an integral part of the hospital and the college over there. But wherever I go, everyone has one thing to say. At the end of the day, she's from GS. So you may go out of GS, but the GSite in you can never go away from you. And I think that's the beauty of our college and hospital. So we are always proud to be GSites and KEMites. And we have to thank you, sir, and the entire faculty for laying our foundation and our love for this institute so strong.
Thank you. Thank you. Just little time for Mustafa Taiwala. Mustafa. Are you there, Mustafa?
He needs to unmute.
Mustu, unmute. Unmute.
Can you hear me?
Yes.
Oh, I'm sorry I'm joining in late, but I'm also on call and I just got back home actually after a long night. But I wanted to say hello to everyone, and I'm so glad this is being organized. I see the Natarajan sir there. My greetings and fond memories. But Amol and the group, thank you for doing this. It's so nice to see all of you. Alka hasn't changed a bit at all, and if I have to go back to memories, they revolve around all these people, right? All of you guys are right there. Such an integral part of everything. We're 10,000 miles away, but we're still right there. So I'm glad that I'm able to do this, even being so far away. And thank you for organizing this. Little about myself. Managed to do gastroenterology. Always wanted to do orthopedics, but didn't realize that the US is not the place for a foreign grad to do that. So switched over to medicine, and then practicing as an interventional gastroenterologist, focused on cancer within the GI world. Shayan's also doing the same. I don't know if Shayan's on the forum, but Shayan and myself, we hold the GS flag high as batchmates doing this. What more do I need to know in terms of memories? I kind of got screwed in GS because I was landed between Satyan and Ashwin. And one guy would do super well, and then I would bring the banner down like really bad. ये बच्चा आ गया, इसको तो सत्यन तो अच्छा करता है, तो ये भी बच्चा अच्छा करेगा. मैं तो बहुत बुरा किया. फिर मेरे बाद बुरे के बाद Ashwin आया. Ashwin बहुत अच्छा करेगा. तो Ashwin got full advantage of me. Roll number 13, 14, and 15. I remember that very clearly. I think I was at trough, and those guys were the epic, the tip of the curves on the top. But having said all of that, I would not have traded anything for my years in GS. Fondest memories, the best of friends, and relationships that at least with the close group that we have that have remained all throughout, despite not speaking for so long. Just picking up a phone and saying hello and chatting, it just brings back old memories. So I cannot say thank you enough to all of you for being such an integral part of our lives. And again, Amol, thank you for persevering and getting me on. I know it was on my calendar, but I was just in the middle of a procedure and I'm coming out now. But I wanted to say hello to all of you. Thanks much.
Thank you.
Mustafa, this must be the longest you must have spoken without pulling somebody's leg.
Are you on, Shayan?
It's not Shayan, it's Prashant.
Oh my God, Kiri.
Don't get stuck with the scope so much. Get rid of it.
Oh God. Well,
So that's
thank
the
you
other
again.
thing that's the other thing about UG. Those nicknames stay. The other day I had to speak to Dr. Prashant Kerkar for a patient, and he tells me, and I was like, "Hi, Keri, what's up?" And he's like, "I'm not Keri, I'm Dr. Prashant Kerkar." I said, "You became that after we knew you. So, century, Mustu is Mustu, Keri is Keri, and so on and so forth."
So Alka, that's exactly what I didn't want. Now you've etched it in the memory of the Gosumec 94 by nickname that is Keri.
I think we all knew that. I don't think she did any more harm to you. We already knew that.
No, there's no harm at all.
Kerry, it doesn't do you justice showing your face. You need to show us your ankles and what socks you have on. That'll really be etched in it.
There you go. There you go.
For
No, I
all you
just got
guys
you
who
on
don't
with
know,
that.
for all you guys who don't know, if I have to pull his leg, Kerry has a fetish for socks. Not that you guys didn't know that, but
I think our time is up now.
That's not true, and I think it's time up now. So I think I just have one request. I think we should end it with, are we ending or there's still more time? Amol and the coordinators?
Setan, do we have time or we should wind up?
I think we should.
Amol,
Yes, sir.
7 was the finishing time. 7:30 stretched time. So maybe
think,
5 minutes more. And then we wind up.
So Amol and all my friends on the group, I just have a request that we'll end it with the chak chaka chak.
Yes, exactly.
Good
Kerry,
idea.
I was saying
Good
that
idea.
only.
Good idea, Kerry.
Yes.
1, 2,
Who's
3.
leading?
Hello,
Are you
Amol.
leading?
Yes, sir.
Amol, because there'll be a video and then vote of thanks. Okay, and then the program will end. And then the recording will stop after that. Okay. So
Sure.
just decide when you want to do the chaka chak.
Okay, now's the right time.
So my request
please do
is,
it. So that
my
students
request,
can
my request is, sir, that you give us 30 seconds before you stop the recording.
go ahead with the 5-10 minutes event. Okay. There's a video and then there's vote of thanks.
Okay.
Okay, I think you can all start with that, Amol.
Yeah.
Chak chaka chak.
Chak.
chak chaka chak chak mak
Chak,
mak
chak, chak,
who
mak,
are
chak,
we?
mak. Who are we?
GSI. Who are we?
Who are we?
Well,
Because the
Can we hand
coordination
over
is not
to-
important, the spirit is important.
yes.
Yes.
Can the students take over?
Yes, thank you everyone. Now I would like the tech team
Yeah,
to play the
students.
reflections video by Dr. Swarupa Bhagwat.
Very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari, Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was Literature and Medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives. priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though these changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
We would like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean, Dr. Pathak, for their continued support and encouragement. We thank the Gosumec Alumni Association for administrative support, correspondence, and financial transactions of Dr. M.V.L. Kothari Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Dr. Maitre for video recordings. Last but not the least, a big thank you to the batch for their enthusiastic participation. Thank you all.
Thank you very much.
Thank you very much. Thank you all.
Thank you, everyone.
Thank you. Thank you, everyone.
Thank you.
Thank you, guys.
Everyone, thank you.
Thank you. Bye-bye.
Bye. Bye.
Bye. Thank you.